Good afternoon, friends, colleagues, and for those of us joining outside Singapore and at whatever time you are joining us, good morning, good evening, whichever is appropriate. Welcome to the RSIS webinar on non-traditional security concerns in the new normal, part 2. As some of you may have followed and may already know, this is the second in a series of webinars organized by the Center for Non-Traditional Security Studies here at RSIS. And it basically shares with you our research on a number of areas on non-traditional security. These are the non-military threats to the well-being and security of states and societies. Now, we find this webinar particularly useful given the current circumstances that we all face. 18 months into the COVID-19 pandemic, we notice and we have observed that many of the challenges, non-traditional challenges that we face, whether it is in food security or climate change, economic insecurity, have been compounded as a result of this long-drawn pandemic. During the first webinar, which we had a few weeks back, we looked at the impact of the pandemic on the triple disaster from the biodiversity crisis, climate change, and environmental insecurity. We also looked at food security and the the peaceful use of nuclear technology on dealing with the pandemic. Today's webinar, we will have a more focused discussion looking at the policy responses, particularly in light of the humanitarian disasters that we're facing. And I'm very, very pleased to welcome our speakers, featuring essentially the team, the Humanitarian Assistance and Disaster Relief team here at the NTS Center, and will be moderated by Dr. Alistair Cook, who is also the coordinator for the Humanitarian Assistance and Disaster Relief Program of the NTS Center. So without further ado, may I now call on my colleague Alistair to moderate this session. Over to you, Al. Thank you.
Thanks very much, and good day to everyone, wherever you are joining us from. As Prof. Melly mentioned, we've got 3 speakers from the HADR program here at the Center for Non-Traditional Security in RSIS. I will introduce the speakers in the order in which they'll take the floor. So first up, we have S.Nanthini, who is a senior analyst with the program. She holds degrees from the University of Melbourne and La Trobe University. Before joining RSIS, she volunteered with the humanitarian agency Red R Australia, where she furthered her interest in the security aspects of humanitarian situations, and has also spent some time at the Asia Europe Foundation. She recently co-authored an RSIS policy report on disasters in COVID-19, implications for Nexus governance. She's also currently working on a research article on Nexus governance, focusing on regional organizations during the pandemic, which will be part of Panorama, a publication for Konrad Adenauer Stiftung. And she'll be speaking on that topic in her intervention. Our second speaker is Dr. Lina Gong, who is a research fellow with the program. Her research interests are in NTS studies in East Asia, humanitarian affairs, China's foreign policy, and global governance. She's published several journal articles and book chapters on NTS, as well as China's foreign policy. She's recently published an opinion piece in the East Asia Forum on the rise of India and China's remote humanitarian aid, a topic that she'll reflect on and discuss in her intervention today. And our third speaker is Chen, an associate research fellow with the program. He has degrees from the University of Melbourne, both undergraduate and graduate, and has research interests in institutional memory, human rights in Asia, forced migration, HADR in the Asia Pacific, as well as politics and conflicts in the region. Prior to joining the NTS Center, he served an internship with the International Detention Coalition, and he's recently presented a research paper titled, "Is Cash Really King? An Analysis of Cash Transfer Programming and Humanitarian Responses" at the Oceanic Conference on International Studies in December last year. He's also co-authored an NTS Insight on humanitarian assistance in the Asia Pacific during COVID, which covers the exact issue his intervention is on today, cash-based programming. Each of the speakers will have 10 minutes for their intervention, and then we shall open up to question and answers. So please enter your questions as you've been asked to in the Q&A function at the bottom. So without further ado, may I now invite S.Nanthini to take the floor and hand over to you. Thank you.
Hi, everyone. Thank you for taking time out of your day to be here today. As already introduced, my name is S.Nanthini, and I'm a senior analyst here at the HADR program here in RSIS. Next slide, please, Joey. So I'll be talking today on COVID-19 and disasters, and specifically how a Nexus approach could be used to approach these in Southeast Asia. So what is a Nexus approach? It is a multi-sectoral approach, and it requires collaboration among various actors or sectors. And what it does basically is that it uses these diverse range of actors towards a collective outcome. And this incorporation of multiple actors, when it makes sense, of course, can be seen as an advantage, because then you have all these individual actors contributing from their own from their own areas of expertise to the situation on the ground. And so while the term Nexus approach is not exactly widely used in Southeast Asia, there's still an awareness of the concept. And here it's mostly seen by the use of terms such as cross-sectoral, intersectoral, multi-sectoral even. And especially during COVID, there's been terms such as whole of government approach, whole of society approach that has been cropping up during this time. So this approach is particularly suited for Southeast Asia and its COVID-19 response, as not only has it had to deal with COVID-19 and its various issues, which have already gone past simply public health, it has also been facing natural hazards during this period and the problems that it has caused then. And so with COVID-19 likely to become endemic to Southeast Asia and the world, this approach allows for enhanced burden sharing between the various actors in the region. So you have like regional actors, you have ASEAN, you have the governments, you have the NGOs involved. And so it informs longer term planning and can also better position, especially governments, to lead in managing these future crises. Next slide, please, Joey. And so what are the challenges to using this approach? One main challenge I found, and it refers to both the first and the second, is an absence of a common vernacular between sectors, and also in non-alignment of planning frameworks between the various sectors. Because what you have here is there tends to be little to no common understanding of the problems, definitions, and terms that tends to be used in each organization or even each sector. And so this tends to be true both even between the sectors as well as within a sector. And assumptions can be made on what certain terms mean, and without discussion, which can be hard, especially in times of emergency where you don't really have time to sit and talk. And so that makes it hard to kind of find common ground between these different sectors or organizations. And so the next challenge is the specificity of funding requirements for organizations. Most organizations, they tend to have funds sometimes which are specifically earmarked for certain activities, certain programs, certain plans, and also these tend to be on an annual basis. And as the Nexus approach emphasizes a multi-year goal, this approach can sometimes be limited in this area. And of course, without funding, it's going to be hard to achieve any of these collective outcomes that need to be achieved. And so the third is the protection of the independence of the humanitarian space. This is a problem that tends to crop up whenever you have NGOs working with governments or you have NGOs working with militaries, as there you tend to run the risk of, as there is perhaps a risk of politicizing humanitarian action. And of course, the last is the existing siloed nature of the humanitarian sectors. And so it is the silos themselves and their individual ecosystems that prohibit, or at least that prohibit any meaningful collaborative effort. And there can be sometimes internal competition within NGOs or humanitarian bodies, or even within the different ministries in a government, where there can be competition in terms of funding, resources, which can make any sort of meaningful collaboration or even cooperation difficult, both in the short term as well as the long term. Next slide, please, Joey. And so what are the policy recommendations for this approach? So first up, I would say it's to establish comprehensive assessments, plans, programs, and result frameworks at the country level to respond to COVID-19 or indeed any disasters. As the starting point for a Nexus approach should always be at least plans that are complementary between different organizations or ministerial bodies. And ideally, what you want it to be is you want them to be joined up. And so, for example, states could look at establishing maybe a national data-driven platform. And in terms of funding, perhaps it could match funders with community projects while acting as the basis for coordination. So that would be, there you would have actors from different sectors being able to utilize this platform for engagement. And so, for example, you have Keto in Malaysia, which is an independent national level collaborative platform that was founded as a response to COVID-19, as a response to the humanitarian need that arose during COVID-19, and has a long-term vision of eventually strengthening the nation's humanitarian crisis preparedness and resilience. And second, to enhance interoperability across ministries and stakeholders. So interoperability within and between ministries has been vital in addressing the COVID-19 pandemic. But then, however, a challenge that has emerged is that the absence of a common operational picture across government ministries. So then you have different organizational cultures and terms. And so because of this absence of interoperability, this disrupts the communication and information sharing between these ministries or in fact, organizations. And so governments in particular should ensure a framework or a policy at least that defaults to a need to share approach, one which defaults to a need to share approach where there would be some kind of common ground, perhaps in terms of a yearly meeting or terms in common, rather than a need to know approach, one which each sector holds its own culture and its own terms jealously without much overlap. And so finally, another recommendation would be to invest more resources in multilateral and regional health mechanisms. And so adequate resources and appropriate financial mechanisms are very much needed to ensure that actors can meet their goals in order for actors to actually respond to whatever crisis that comes up. And so rather than depending solely on external donor funding for organizations, innovative financial mechanisms should be embraced where necessary. So given this clear transnational impact of the pandemic, substantial investments in multilateral and regional health mechanisms is extremely important. And building this sort of a more cooperative, collaborative, intersectoral, multi-sectoral, whole of society approach would be key for any sort of for for the success of any response. Thank you.
I think you've raised a number of important points there, and it's, I guess, the most obvious to us in this region when we look at the impact disasters have had during the COVID-19 period, whether it is the restrictions placed on social movement and the need to readjust our evacuation procedures is one particular example, which I think this shows the need for more thought and interaction across the different sectors, whether it be health or NDMOs, National Disaster Management Officers. Okay, so with that, I would like to now invite Lina to share her presentation and her reflections. Please, Lina, the floor is yours, 10 minutes, and it's over to you. Thank you.
Thanks to Al and Nanthini for setting up the stage, as well as Prof. Melly's introductory remarks. My engagement in today's webinar will be from the perspective of remote programming in the humanitarian sector and the opportunities for emerging donors. But because of the time strain, I think I will focus on what remote programming is and why it has been rising during COVID-19. And if there is time left, then I will talk about what are the opportunities for emerging donors, which play a more important role in and will play a more important role in the humanitarian sector in the future. And let me share my screen. So first of all, I'd like to discuss a bit about the changing or evolving humanitarian landscape even before the outbreak of COVID-19. And first of all, climate change is a major risk factor. According to the latest IPCC report released in August 2021, without immediate and rapid and large-scale action, it is very likely we are going to see global temperature rise by 1.5 to 2 degrees Celsius in the next few decades. And what does it mean for the humanitarian sector? Among a lot of the few scenarios, the most likely scenarios is that we are going to see the concurrence of multiple disasters. And this means much greater stresses on the global humanitarian system, which is now already overstretched. And another risk facing the humanitarian sector is that the operating environment for humanitarian agencies and humanitarian workers is increasingly unsafe. According to the latest study, in 2019 alone, 483 humanitarian workers were either killed, wounded, or kidnapped. It was the highest number on record. Well, despite all these challenges, the humanitarian sector has also been taking action, and we have coming up with innovative solutions to all the challenges facing humanitarian action. We have seen greater use of technologies, online platforms, drones, robotics, etc., for humanitarian purposes. All these dynamics trends have set the stage of background for greater use of remote humanitarian programming during COVID-19. As we have seen, COVID-19 has caused a lot of disruptions across a lot of our societies, including the humanitarian sector. There are many impacts. I will just focus on a few, the most significant one. The first one is the curtailed deployment of staff. Because of travel restrictions on both international and domestic travels, international humanitarian agencies are unable or unlikely to deploy their staff to countries affected by natural hazards or facing ongoing humanitarian crises. And in addition, International and local humanitarian agencies also have imposed some precautionary measures to protect their staff from being infected by COVID-19. So according to the latest study, in August 2020, about 70 NGOs in Myanmar were suspended because many of their staff were tested positive. And OCHA alone in September 2020 have about 600 staff under quarantine. All these developments have curtailed the deployment of international staff to countries facing humanitarian needs. And the second impact is the disruption of supplies of humanitarian aid. Because of COVID-19, we have seen disruption in air and sea flights. We have seen longer processing time for humanitarian aids at the customs. And we have also seen some government impose export restrictions on certain humanitarian supplies. In addition to these two disruptions, we have seen other disruptions as well. Countries have implemented prohibitions on large gathering, and this has wide-ranging impact on the humanitarian services as well. For example, 1.6 billion learners across the globe were affected by the closure of schools or learning centers. And so safe distancing also put a higher requirement for like sheltering services and other essential services. In response to all these constraints and restrictions, international humanitarian agencies have come up with some alternative solutions. One of them is remote humanitarian programming. First of all, what is remote humanitarian programming? This kind of a modality of aid facilitates connections between international and local humanitarian organizations, which enables foreign humanitarian actors to connect to those in need without being physically present in the areas affected by humanitarian challenges. Well, this modality is not new actually in the humanitarian sector. In the 1990s, international humanitarian actors withdrew from fragile countries such as Somalia and relied on remote programming to provide aid to those in need. And essentially, there are different forms of remote programming. One is remote control, which means the majority of decisions power remain with international managers, while local partners are mainly responsible for implementation. Well, another form is remote delegation. It means a higher degree of authority or power delegated to local partners. And the next form is remote support, means even higher level of authority and power with local partners. While international actors remain controlled in terms of finance and strategic planning, while remote partnership means the highest level of authority for local actors, means they are having significant power in terms of decision-making and strategic planning in the future development of their organization. So the more preferred mode of remote programming will be remote support and remote partnership, because it means more authority and power for local actors, which conforms to the localization trends in the humanitarian sector, which has been called for since the Global Humanitarian Summit in 2016. And then remote remote programming during COVID-19. Why is it necessary or needed? As mentioned earlier, security risks is a major factor behind remote programming. And the outbreak of COVID-19 also point to the need of taking consideration of health factors. We need to protect humanitarian staff from infection risk and travel restrictions as well. And the second point is the remote programming during COVID-19. It means remote management, like from project design, monitoring, coordination, and implementation, we remote control. And it also means online learning, online training for local staff, local health workers. So what are the conclusions we can draw from these preliminary study? First of all, is remote programming has long been viewed as an just ad hoc mode of assistance. However, the outbreak of COVID-19 can be a catalyst for greater use of remote programming in humanitarian action. And in addition to all these development, we need to pay greater emphasis on building the capacity of local partners. Despite the greater call for greater emphasis on the role of local actors, we still have been seeing complaints about limited resources, funding allocated to local partners. So this part should be strengthened in the future planning of humanitarian action. So these are the preliminary finding of my research on remote programming. I am now giving back the floor to Al. Thanks, Al.
Yeah, there's definitely a lot of developments at the moment in terms of remote programming. And as you mentioned, one of the concerns really is about the transference of risk from global actors to local actors, and whether they have the commensurate power and money, or whether it is just being subcontracted out to local actors and then bearing the brunt of the exposure and the risk in humanitarian situation. Next, we have Chris, who will be talking to us about cash-based programming and the developments that we've seen during the pandemic and more recently as well. So Chris, 10 minutes, the floor is yours.
Thank you. Okay, hi everyone. Good afternoon everyone, or good morning, wherever you are at. So my name is Chris. My presentation will look at another operational modality that we have observed in the humanitarian sector. So broadly, it will look at the impact of cash transfers on the well-being of vulnerable populations, as well as some of the challenges that humanitarians are facing when trying to implement these cash-based interventions. And finally, it will look at the future of cash programming. Next slide, please. Yeah, so this is just a broad outline of my presentation. So I'll start with the introduction, followed by some of the arguments for the use of cash, and then the challenges of implementing cash-based programs, and then finally I'll end off with the future prospects. Next slide, please. Okay, so donors and humanitarian agencies are increasingly viewing cash-based interventions as an appropriate emergency response to meet immediate needs in the aftermath of a disaster or a crisis. So the relative success of cash transfer programming in recent major disasters has actually helped to strengthen its position as a significant response option. So for example, in 2013, in response to Typhoon Haiyan in the Philippines, 500,000 of the affected people actually received cash through the extension of existing government social protection programs. So by providing affected populations with immediate access to funds to purchase supplies, this cash-based interventions actually cut down on the time delays that are often associated with procurement procedures of in-kind donations. Before I carry on, for the purpose of this presentation, I'll be using the term cash and voucher assistance, or CVA in short, which is the recommended umbrella term for any humanitarian programming which uses cash and/or vouchers. So while cash programming is not a new concept in the humanitarian space, it has gradually been gaining traction in recent years. So for example, between 2015 and 2019, cash and voucher assistance actually rose from, the use of cash and voucher assistance actually rose from $2.2 billion to $5.6 billion, making up 17.9% of international humanitarian assistance. So this is it's not a new concept, but what is new is I guess with the onset of COVID and the pandemic is that it is growing importance compared to in-kind aid, which has traditionally been the de facto form of aid that international international organizations prefer. So in the pandemic, cash assistance has actually been a very popular response, with around 429 programs being introduced by 164 countries since March 2020. And it has proven to be an efficient means of getting support to affected people fast. It also provides protection, it empowers families to meet their basic needs, as well as it mitigates some of the negative socio-economic impacts of COVID-19. Next slide, please. So why cash? There is actually growing evidence of, various advantages from the use of cash-based interventions in contexts where they are appropriate. So these are just some of the reasons advocated by proponents of cash-based interventions, or CVAs. So firstly, disaster-affected populations can gain more autonomy and flexibility to choose how they want to address their needs, which will lead to a greater sense of dignity and agency. So providing cash actually helps to align the humanitarian system with what people need, rather than what humanitarian organizations are mandated and equipped to provide. So next, studies have shown that cash disbursements have generated positive impacts on local markets and economies in the aftermath of disasters and crises. Cash-based programming can help to support the local economy by encouraging purchases from local suppliers. And cash transfers can also make limited humanitarian resources go further, because it usually costs less to get cash transfers to people as compared to in-kind assistance, because partly because like aid agencies do not need to transport and store physical relief goods. And with the growth of digital payment systems, cash can actually be delivered in increasingly affordable, secure, and transparent ways. By providing affected populations with immediate access to funds to purchase supplies, it also cuts down on time delays that are often associated with all these procurement mechanisms. And also, contrary to belief, the recipients actually do spend the cash on necessities as opposed to temptation goods like alcohol or cigarettes. And the last point is in terms of the COVID situation, in a disaster pandemic situation, so cash and voucher assistance is actually seen by some as a safer option for providing rapid relief where conditions allow. We are increasingly seeing humanitarian organizations, switch from in-kind assistance to cash-based interventions, which allows for more remote delivery, and as well as less clustering at distribution points and distribution sites, which in a sense will reduce the transmission risk of the virus. So for example, instead of setting up a food distribution station, digital or mobile cash transfers can be actually dispersed to the affected population, and this provides them with cash to buy food at their own convenience and helps avoid the massive gatherings that food distributions often create. And so this, in a sense, in a COVID situation, this will help with social distancing mechanisms and procedures. Next slide, please. So these are two recent case studies in the region which showcase some of the benefits of using cash-based interventions in the COVID context. For example, in the Philippines, when cases of COVID-19 increased in many of the communities, Oxfam and its partner organization, the People's Disaster Risk Reduction Network, PDRN, actually adapted existing cash transfer programs, which is in this case the Be Ready program. And they adapted this program to provide electronic prepaid cards to deliver humanitarian cash assistance directly to households before any disaster strikes. So Oxfam and its partners were able to co-develop and adopt context-specific cash transfers and safety protocols for COVID-19 to ensure that the program activities could be safely delivered, and more importantly, all forms of assistance actually were complied with local and national regulations in the context of the pandemic. In Malaysia as well, the UNHCR actually provided cash assistance to help mitigate the social economic impacts of urban refugees. So I think 80% of the cash recipients had actually experienced some form of loss of income during the movement control order that was established in Malaysia. And 85% of the recipients indicated that they received the cash in time to meet their most essential needs, which include paying for food, paying for rent, paying for utilities. And I think more than 30% of them actually felt that this cash assistance had significantly improved their living conditions and reduced their feelings of stress and helplessness. Okay, next slide, please. So yeah, obviously implementation, however, comes with various challenges. So firstly, like how do we actually implement digital CVA programs in communities without adequate digital infrastructure, as well as how do we implement these programs in communities without robust markets as well, and how do we actually reach vulnerable populations who are not in existing programs or databases, for example, in rural areas. And last but not least, what happens when the cash is disbursed, but movement and supply chain restrictions actually prevent affected populations from purchasing the necessities and the goods. So in my next slide, I will actually use some of my insights derived from my fieldwork in Fiji and Tonga to illustrate the following challenges. So despite the considerable use of cash-based interventions by governments and non-state actors in major emergencies around the world, the use of these interventions in humanitarian responses in the South Pacific has actually been at a relatively small scale and limited to only a few countries. So for context, these countries are actually small island developing states, and its populations are usually spread across multiple islands. They also have limited access to financial services on the remote and outer islands, and more often than not, the populations have a low level of financial literacy as well, especially in rural areas. So as the two quotes above illustrate, they showcase the limitations of cash-based interventions in these countries. It demonstrates that cash might actually only be appropriate in situations where food or other items that people need are available in local markets, or can actually be supplied relatively quickly through market mechanisms. So I mean, as I mentioned before, right, access is a critical issue in Fiji and Tonga. Even in peacetime, transport is costly and time-consuming in most rural areas, and even in times of disasters, access routes might be damaged, and it takes longer to reach all these rural areas and outer islands. So all these access constraints actually suggest that the degree to which cash is a feasible way for people to meet their needs after disasters is actually strongly related to where they live and their accessibility, their relation to markets. Next slide, please. Last slide. So what does the future of cash and voucher assistance entail? Firstly, I think that the humanitarian sector needs to develop equitable partnerships with local and national actors to create flexible and adaptable programs for direct and remote distributions of cash and voucher assistance. There is also a need to improve on digital delivery systems so that to improve the vulnerability gaps in the technology as well. And also, using all these innovations, it can also help to improve monitoring and evaluation processes, while also improving the user journey for aid recipients. But the second point is actually the one that I feel deserves more attention, and that is the importance of taking context into consideration when deciding whether or not to implement cash and voucher assistance programs. So cash programs do have the potential to provide many positive outcomes for vulnerable communities. However, they can also have many unintended or adverse effects. So I think it's important to assess the context in which these models are implemented and understand that simply shoehorning such modalities into situations and localities which are not ready for them is ethically and socially irresponsible. For example, judging the ability of markets to respond to an injection of cash is a critical component of assessing the appropriateness of cash. And also, when using digital technologies to facilitate cash transfers, how do we actually uphold the data privacy and security of vulnerable and marginalized populations? And last but not least, how do we reach people who do not have mobile phones or the relevant technological expertise? So all these are actually factors that we need to take into consideration, and that the humanitarian actors need to take into consideration when considering whether or not to apply these cash-based interventions. So at present, cash-based interventions might be an issue in countries without necessary infrastructure or access, but it is definitely a worthy endeavor for future investment, which could actually shape the way aid is being provided in the post-COVID-19 world. Yeah, thank you.
We've had a number of questions here, so I think I will just now open the floor for Q&A, and I'll be doing that by checking the Q&A function and however people have given me questions here. And I'll do it firstly in a couple of rounds. So I'll group some questions and direct them to the relevant panelist. And if other panelists want to answer that question, they can do so as well. So one of the questions here for S.Nanthini is about the Nexus in practice. So you've given an outline of an abstract concept. So I'm wondering if you can perhaps give us some more examples of what it would look like in practice. Because from the general understanding that there's a presumption that everyone should be pitching in, regardless of where they are in what sector. Has it been proven as a concept in practice? Or is it just a new way that remains untested for us to be governing non-traditional security? Then for Lina, what role might artificial intelligence play in remote programming with respect to humanitarian action? For example, in the context of COVID-19, would artificial intelligence facilitate carrying out mandates by international humanitarian agencies? And can you provide any examples? And a question then, I think, for Chris is over the role of, and I mentioned this a little bit earlier, of risk transfer. So how can you ensure that the communities that are being engaged with cash-based programming realize what the potential risks are for their engagement in those sorts of programs? You illustrated where it perhaps wouldn't work, but then what about the individuals in the communities if the trade-off for them is that they have to give a lot more information and data to a particular organization in exchange for getting access to the cash? So how aware are they of these issues, and have you seen anything around that? So that's a question each for you, and then I will go back after I've heard from each of you back to the Q&A function, and there are another round of questions in there. So why don't we go in the order in which you spoke first? So S.Nanthini, if you've got some reflections on Nexus in practice first, and then we'll go to Lina and then Chris.
Thank you for your question. So regarding this, I would say that, so the original Nexus concept per se was developed around 2016, 2017 by the UN through their new way of working. So originally it was very much a approach in which UN actors wanted to bring in actors from outside of the UN system into whatever programs or plans or programs that they were carrying out in various countries. But this can very much be adapted into other areas as well. So for example, one of the examples that I brought up earlier was the Keto match in Malaysia. So what it was that this wasn't just a strictly sort of government NGO kind of collaboration. It was an independent, I would say, independent data-driven platform that was depending on various sectors that allowed the private sector to come in, the NGO sector to come in, as and when to fill the gaps as necessary. So you had areas that needed funding. You had, let's say, this village that needed toilet paper or needed medical supplies or needed food. And then this platform allowed sort of like the various private sectors or various NGOs, even individuals, to actually come in and fulfill the gaps where necessary. So this was very much a intersectoral approach to I guess, a need, a gap in the humanitarian system. I'll just leave it there, and I can add in where necessary.
Thank you. Okay, Lina, perhaps you can have a go at answering that, but if you can keep it to about a minute so we have a chance to go through the remaining questions.
Sure. Actually, there have been many examples of use of AI even before the outbreak of COVID-19. Since I mentioned the role of emerging powers, emerging donors, I will just use an example from that. The Chinese company Alibaba Group entered into a partnership with World Food Program. They launched the project of Hunger Map Live. This is to monitor the level and the magnitude and severity of hunger, malnutrition in over 19 countries, and through big data analytics to predict and track the changes in the food sector or food security in these countries. And the idea of the theme I mentioned earlier is like how COVID-19 has called on draw countries and humanitarian actors even recognize more or value more the role of international technologies in the humanitarian sector. So yeah, that's my response to the question. Yeah, thank you.
Great, thanks. Chris?
Yeah, so in terms of risk transfer to vulnerable populations, I think this raises the importance of education and awareness building initiatives. So all these, instead of just focusing on providing the aid and providing assistance, humanitarian organizations also have a responsibility to build awareness within all these communities in terms of what risks and what these risks would look like. So, for example, the use of digital cash transfers, right? That probably involves the collection of digital data as well. So, I mean, humanitarian organizations need to ensure that all these risks are made known to the vulnerable populations. And this leads on to the next point about how international humanitarian organizations need to engage with local partners, because these local partners are normally the people with the grassroots leaders who understand the cultural and social context of the people that they are trying to help. So these partners can help to, and this ties into Lina's point on remote management as well, right? I mean, it's not just a top-down approach, but it needs to be a collaborative process. That's my short answer to it.
Great, thank you. Now for the remaining questions, I will go through these and then we'll do the same as a final round. And if you have any other comments you wish to address in that session, then in that round of questions, then please do so. Most of these questions are for the whole panel. So the first one here from Salil is asking about when the humanitarian disaster occurrences become frequent, one needs to derive sustainable solutions. So what would be the steps for reasonable and long-term sustainable solutions? Then we have a question from Alden Lee. How might the Nexus approach, remote humanitarian programming or cash-based programming, work in conflict scenarios? And they offer the example of Myanmar in this region, where it is currently under martial law with minimal allowance for collaboration among various stakeholders. So how would you go about doing that in these conflict zones? Then we've got a question from Ling here. From your respective points of view, has the experience of COVID-19 accelerated or evolved disaster response in unexpected ways? So have we seen anything that has happened that we didn't think would happen? And then the last two here, one from Margaret for S.Nanthini, would preparing common indicators help to synchronize different frameworks that mean similar things? To Lina, would remote programming be a game changer in the humanitarian field post-COVID? Would there be less direct involvement from external humanitarian actors, for example? And to Chris, cash intervention helps affected populations, but wouldn't this make the monitoring and evaluation be affected or limited? How would you go about monitoring and evaluating its impact? And then the last one here is directly for Chris. In an operational sense, can you think of any examples of how humanitarian agencies have handled CVA during temporary electronic network disruptions. And what lessons have they learned in this particular context? And have they had any contingencies factored into their planning for that? So we have just under 10 minutes left. So we've got about 2 to 3 minutes, but try to keep it close to 2, please. So first, Anthony, and then we'll go to Lina. Thanks.
To answer Salil's question, so what would be the steps for reasonable or long-term sustainable solutions? And for one of that would be to empower local and trusted humanitarian actors. So localization is a big part of the Nexus approach. And so what you would do, and so empowering these local actors, local staff and organizations, particularly for the larger international NGOs who mostly rely on international staff, that would be a big part of this. As well as funding, you would need kind of internal funding, not just rely solely on outside donor funding as well. Internal funding through maybe insurance, insurance schemes, or other innovative financial solutions. That would be, I guess, that would be some of the steps to drive long-term relations. As for, okay, so as for Alden, that's a good question, because when you have, I think in areas such as Myanmar, where you don't quite, where perhaps the collaboration might be a bit limited due to the uncertain situation, that's when I think you would run into problems, because a key part of the Nexus approach is trust. And without trusting your, I guess, the other actors, it would be hard to actually contribute to any kind of outcome, any kind of goals. For Margaret, so would preparing common indicators help to synchronize? Yes and no, because then the problem there lies again with how would you agree on a common indicator, especially when you're coming from maybe two quite different frameworks, perhaps NGOs and militaries. You are going to have quite disparate kind of outcome, quite disparate goals and quite disparate viewpoints on things. And that's where the problem lies. And another thing is that times change. Times are moving very, well, not times, but emergency situations, they tend to move very quickly. So unless there is already a prearranged period, maybe beforehand, where there's building some sort of common ground, building some sort of framework, that's I guess where you would be able to prepare these indicators to synchronize the different frameworks. I think my time is up. So
yep. Okay, Lina.
Yeah, thanks, Hal. I will combine my responses to all the questions. I think to make more sustainable solutions to all the humanitarian challenges we face, first we need to expand the source of support we get from the international community. Apart from relying on the traditional established donors, we also tap into the resources and support of emerging donors, the private sector, the whole of society. So with regard to emerging donors, apart from tapping into their financial support, we can also engage them in terms of their technology companies, their manpower in terms of medical staff, health workers, experience, expertise through like online training, online learning, e-learning forms. So another point I want to raise is to avoid a digital divide between within societies, to make sure the marginalized communities, groups are also included in the assistance provided. As Chris just mentioned as well, and some participants' questions also touch on the point that what if there were like disruption in the technology aspect, how we cope with that? It is important that for companies or private sector, as well as humanitarian actors, to develop like contingency plan to take into consideration these scenarios. And the third point I want to mention, which I think is the most important, is to build the capacity of local actors. We have seen the transfer, to some degree of transfer of resources, authority to local actors during COVID-19 because of all these constraints. And the hope now is to make this sustainable in the long-term transformation. This also answers Margaret's question, whether it's a game changer or it's just one-off development. So the important thing is to build the capacity and raise the awareness of their importance. That's my response. Thank you.
Thanks, Chris.
Okay, yeah, I'll try and combine my answers as well. So in response to the question on the operational disruptions as well as lessons learned in the field, I think off the top of my head, I can think of like maybe two organizations, Save the Children and World Vision, who in Fiji and Tonga actually came up. I mean, they didn't actually deal with the. I think in the questions in the question you mentioned, temporary electronic network disruptions, right? But it's more of like these organizations actually conducted feasibility studies beforehand, before implementing the interventions to see whether conditions were actually were the conditions favorable for the implementation of these programs. And I think these feasibility studies actually included seeing whether the digital infrastructure is actually in place, whether people have knowledge of the tools available to them, as well as whether or not would these people, the vulnerable populations, actually preferred cash over in-kind assistance. So I think the lesson that can be learned is that before you actually implement a particular intervention or a particular program, you need to actually do a sensing on the ground, a ground sensing, which involves working with local partners and local and national partners to see whether whether the context is correct, whether the context is suitable and viable for the implementation of any particular program. In terms of whether or not cash, like how in terms of the monitoring and evaluation of the use of cash, that's a very good question. But I think it's more this builds in directly with the question before that I answered beforehand, as in there needs to be feasibility studies to see whether or not these people, the vulnerable populations, will actually use the cash in the desired ways and outcomes. And as I mentioned in my presentation, most of the time it's been found that populations actually use the cash for necessities as opposed to spending them on vice items such as cigarettes or drugs or alcohol. And in terms of to answer Yiling's question on how has COVID-19 changed the disaster landscape, I think like what Lina mentioned, there's been a lot of disruptions in terms of supply chains and in terms of the movement of people, movement of humanitarian personnel. So I mean, how that ties into for example, cash-based assistance is that, I mean, you can give people cash, but if there are no markets, if there are no functioning markets, or there are no resources goods available in the markets due to restrictions on imports and exports, then there's no point, right? There's nothing to spend the money on. So I think, I mean, the whole pandemic has actually changed the way we need to look at how organizations actually can provide aid to all these vulnerable communities. I think that should cover it.
Okay, I'd noticed that there's two other questions, but one's directed at Chris. So Chris, you can answer both. One is, how can governments provide cash-based assistance to individuals who have fallen through the cracks, i.e. those outside the national registry? And then there's a big question, which everyone could perhaps chip in, but we're limited to time here, and it is, do you expect in the foreseeable future humanitarian assistance programs being managed by robots, drones, and digital run equipment? And how soon will that happen in our region? Do you think we will take it on or not?
Okay, yeah. So I'll reply that question from Louis. So I think it's important to state that it's not only governments who should be providing the assistance. I think it needs to be a whole of I mean, this is a buzzword, right? Whole of society approach. So we need to involve humanitarian organizations, grassroots organizations, community-based organizations as well, to sort of identify who, I mean, before we can actually provide assistance to them, we need to identify who are they, right? And what, and their status, the legal status, their vulnerability status and whatnot. So we need to work with all these different actors to identify people who have actually, who are not actually in national databases, who are not involved in, or rather who do not have financial statuses, like they don't have bank accounts, for example, like in Fiji, some of the people in the rural outer islands areas, they don't have access to bank accounts. So I mean, we need to, that's where the local partners come in, right? I mean, that's where the localization agenda is so important. Yeah.
And the question, the other one?
So what's that?
That is asking you about the future of digital drones.
Oh yeah, okay. Yeah, I mean, technology is always a tool, right? It's always an enabler for more effective humanitarian aid. But I think we need to be careful and wary in terms of how we engage with such technology. There are a lot of data privacy concerns, right? In terms of the use of big data and remote sensing. Yeah, I mean, so the tools are always available. I believe that tools are always available. But I think the short answer to this is that, yeah, we need to carefully assess the risks involved and any negative sort of externalities that might come about through the use of this. Yeah.
Great, thank you. So that brings us to the end of our presentations and the Q&A. So thanks to the panelists for your interventions and for managing to get through all the questions in the required time, so we're not in trouble for ending late. And so with that, I'd like to thank the audience and perhaps pass back to Prof. Melly for some final comment. Thank you.
Thank you. Thank you to all the panelists. I'm delighted to have heard the different presentations sharing their respective research. And I'm sure our audience have enjoyed it as much as I did. Just by way of closing, a major question that's always asked, and in fact, you see this not just here, but in media and in television, are we really living in a new normal as a result of the pandemic? And I guess the pandemic, as the presentations have shared with us, just accelerated the newness of things that we are supposed to do, newness in the way we do things or in the way we deal with issues. And from the presentations, the buzzwords that we've heard are, one is innovation in the way we do things, engaging as many partners, looking for partners so that we can have a whole of society approach so that you are able to have a more comprehensive Nexus type kind of approaches. And in partnership, we also look at local partners because they are critical actors, especially when remote kind of humanitarian operations need to be done. We also talked about technology and how technology is important, at the same time ensuring that for it to be sustainable, you minimize digital divides. And of course, there's also sustainability in resources, hence increasing the pool of your usual suspects for humanitarian actors, as well as increasing partnerships with other actors like the private sector, as mentioned. We can go on, but I guess what this series of webinars have shown to us, for those of us who are working in the field or listening or doing our own things, is that given the new challenges posed by disruptions like the pandemic, we really need more conversations of this nature, because as we now know, it's not just us working in our own respective fields, but really there's the need for us to engage with others who share the similar interests and similar vocation. And in a more complex environment, that cannot be understated, more innovation and different way of thinking really is required. And this is what I guess this new normal actually means, if you were to operationalize that. A more creative way of doing things, engaging more partners and using the tools that we have before us. So with this, I have the pleasure of closing this webinar and to thank once again the team in the HADR team of the NTS Center here at RSIS. And I guarantee for our audience that there will be more of this presentation as our team shares with you their ongoing researches. On behalf of RSIS, I now declare this webinar as closed. Thank you very much.